Last week, Transport Minister Eamon Ryan said that he expected approval to be granted soon for the Dublin MetroLink railway, and that construction, he expected that would begin this year, and the project is officially expected to cost about €9.5 billion and will take an estimated 6 to 8 years to complete. But why should the public have confidence in this project given the cost and time overruns on other projects like the National Children's Hospital, for example?
Because the cost in relation to huge projects like the Metro or like the National Broadband Plan now reflects the learnings that we have in relation to the Children's Hospital. So what we are now doing for huge projects such as those is we are publishing clearly a range of costs, and we are saying these are the different things that could happen that could influence the cost of projects that take years and years to deliver, that are very, very complex. There's a select number of projects that have had risk in relation to their cost. The National Children's Hospital is clearly one of them. And for other projects like this, like the National Broadband Plan, it's the reason why we published a range of costs and outlined the risk in relation to them. So why the country should have confidence in the delivery of big public projects from the state, it is because despite the effect of recent inflation, we are still successful in delivering the majority of capital projects in line with how much we expect them to cost and roughly on time. That's still the case with the majority of projects that we build, but of course there are clear learnings over many years from the Children's Hospital that in turn has impacted how we evaluate and how we communicate projects like the Metro.
But I mean, in previous years, there have been assurances from, for example, Taoiseach Leo Varadkar, who many years ago he said that short of an asteroid hitting the Earth, the hospital would be completed by 2020. And of course, even before 2020, that was pushed back. So I suppose what I'm saying is there have been assurances made to the public previously that didn't materialize when it comes to projects like this. So could this not be another instance of that?
But this is why then when we are communicating projects like the Metro, we are far more careful about indicating when this project could be open. That then sometimes leads to the criticism that it's taking too long to deliver it and that this project is many, many years away. But we are now very clear in communicating for projects of this scale that this is what we expect it to cost. But there are risks to that cost, and there are also risks to the timeline. It's what we did in the National Broadband Plan, but if you look out at the role of the National Broadband Plan, it's a project that we're now delivering on time, and it's a project that I'm confident we're going to deliver in budget as well. And I have to make the case for that different way of evaluating big projects that builds on the lessons of the National Children's Hospital, showing what government did learn from this particular project.
The Health Minister, Stephen Donnelly, denies that it's the most expensive hospital in the world. Would you say that?
I have all my friends from Germany just waiting behind us to participate in a conference. We'll come back to that another time.
We will indeed, no problem at all.
Thanks now.
God bless.